Hello everyone, we are Group 7 and our subject is skin cancer and M Health. My name is Aryata Balidemai and my group mates are Melissa Ditmore and Leash Newland.
Skin cancer reached epidemic proportions globally by the turn of the millennium. Skin cancer is the most common form of cancer in the United States, and it's increasing. There are many different kinds of skin cancer, including basal cell carcinoma, squamous cell carcinoma, Merkel cell cancer, which is fast-growing, and melanomas, which can be fast-growing and fatal. Other non-melanoma skin cancers include skin lymphoma and sarcomas, including Kaposi sarcoma. While there are many different kinds of skin cancer, the majority of skin cancers are melanomas, which are nearly all caused by exposure to sunlight. Melanomas seem to be caused by intermittent exposure to sun, in contrast to squamous cell carcinoma, which seems to be caused by cumulative exposure to sunlight. This kind of cancer can often be prevented by the use of sunscreen. Sunscreen has been promoted for the protection of the skin from sunburn and cancer and premature aging. However, a survey of different sunscreen availability in Chicago neighborhoods found that sunscreen was less available in Hispanic neighborhoods and that a smaller variety of brands was available in Hispanic neighborhoods. Incidence rates vary widely, with the highest numbers in New Zealand at 50 cases per 100,000 people and Australia at 48 cases per 100,000 people, with a big gender divide, followed by the US at 21.6 per 100,000 people and Europe with 13.2 for men and 13.1 for women per 100,000 people. These numbers are from Apala et al. From 2017. Skin cancer is increasing, particularly among light-skinned people. However, even as people with lighter skin are more vulnerable to skin cancer, people with darker skin have worse outcomes for skin cancer. One factor is that medical textbooks typically include pictures of conditions on fair skin. This is a medical injustice with real consequences seen in the poorer outcomes for skin cancer patients with darker skin. In the US, skin cancer numbers have stabilized, but skin cancer rates are rising among Spanish-speaking people. One factor is that as Hispanic people acculturate to American culture, they spend more time in the sun without sunscreen, and many have less access to health care. Immigration status is a factor in this lack of access to care. In this way, skin cancer reflects social determinants of health.
This infographic depicts the different levels of skin cancer risk based on skin color as well as their corresponding UV sensitivities. Lighter skin is highly sensitive, more susceptible to burning instead of tanning. Lighter skin also poses the greatest risk for developing skin cancer. Darker skin tends to be minimally sensitive, unlikely to burn, and poses the least risk for developing skin cancer. People with darker skin who do develop skin cancer are more likely to receive a late diagnosis when the disease has often progressed to a more dangerous stage.
Traditional diagnosis of skin cancer is made by a dermatologist looking at the skin. Training for dermatologists to recognize skin cancer typically uses images of conditions, and these images overwhelmingly feature white people. This creates difficulty for doctors when diagnosing patients with darker skin because dermatologists may have not seen the condition on different skin tones. A team of 3 scientists have explored using artificial intelligence to generate images of various skin conditions, including cancer, on tan, brown, and black skin in their classification. These images are generated using artificial intelligence. This slide shows examples of their AI-generated images of various conditions on darker skin tones than are typically included in diagnostic resources.
Diagnosis of skin cancer is traditionally done through visual examination by a dermatologist, either in an annual screening or when a patient presents with a concern. Typically in the United States, only people with health insurance will see a dermatologist for an annual exam. A next step could be a laboratory examination of a sample, otherwise known as a biopsy, to determine whether cancerous or precancerous cells are present. More specifically, it is a medical test involving extraction of sample cells or tissues for examination. Dermoscopy, as shown in the graphic, involves an evaluation of the skin surface. Skin lesions are examined through the use of a handheld instrument called a dermatoscope, which has an illuminating light source and magnifying optics. Traditional treatment of skin cancer includes removing large and changing moles or other concerns by freezing or burning or cutting out of the skin, especially those from which a biopsy has demonstrated the presence of cancerous or precancerous cells. This is also known as simple excision. Mohs surgery is the gold standard and involves the removal of one layer of tissue at a time, shown in the graphic, for examination under a microscope. Radiation therapy is also part of traditional treatment for some cases of skin cancer.
Technology-based applications for the treatment of skin cancer can have many benefits. Recently, applications have been created to detect skin changes. Some of this new technology was established in response to the COVID-19 pandemic when many people were avoiding seeking medical care unless they were critically ill. During this time, many people chose to skip their yearly skin checks, and applications such as Skin.io can help increase awareness for skin cancer, in addition to allowing more of the population to have access to a screening tool. Support from artificial intelligence can help improve dermatologists' accuracy of identifying benign moles in comparison to melanomas. The use of artificial intelligence to assist in the classification of skin conditions can positively impact patients by improving the efficiency of healthcare delivery. In November 2020, an application called Skin.io was introduced in a trial study. Skin.io is a downloadable mobile application available to Apple and Android users. The application allows users to photograph skin lesions, rashes, moles, etc. to send to images to healthcare providers. Skin.io uses the camera on users' smart devices as a screening tool. It also guides users, directing them in order to obtain clinical-grade photographs. According to the Skin.io website, it is the easiest way to get an annual skin screening without having to physically go into a dermatologist's office. The purpose of the application is not to give a diagnosis, but to highlight skin conditions that are considered suspicious for disease. Skin.io determines by algorithm areas of concern based on the self-taken images. After images are taken and submitted through the Skin.io app, an expert dermatologist then reviews the images. The dermatologist then determines if there are any spots that are worth concern. Users are then notified by email with either dermatologist recommendations, whether no follow-up appointment is required at that particular time, or a recommendation is provided to schedule an appointment with a dermatologist and then provide suggestions for how to proceed in finding one.
Neural networks are an artificial intelligence technology that can learn a specific task. Neural networks have been shown thousands and thousands of images of skin cancer. These neural networks have learned from these images, and now neural networks have become at least as good at diagnosing skin cancer as dermatologists looking at skin. The SMARTY trial in Australia was the first to use artificial intelligence to try to test artificial intelligence's success at melanoma diagnosis. Images of questionable features of skin were taken and shared with an artificial intelligence neural network. The neural network had been shown many examples of skin cancer and used artificial intelligence to diagnose the images. The AI diagnosis was compared to a clinician's diagnosis. Felmingham et al. Pointed out that when AI and clinicians disagree, patients were very anxious, and this anxiety may have affected patients' decisions about whether to take a biopsy.
Another example of a mobile health technology in the detection of skin cancer is an intervention called Skin Vision. It is a regulated medical service. It expands the ability to self examine skin by utilizing artificial intelligence with assistance of medical professionals. It can be used to detect signs of common skin cancers with up to 95% sensitivity. The goal of Skin Vision is to ensure users visit the right providers at the right time. Early detection for skin cancer is key. As far as access to Skin Vision, it is considered a premium paid medical service. It is covered by insurers, businesses, and global advocacy groups. The cost for Skin Vision includes multiple packages available in 12-month, 3-month, or single installments. For single use of the Skin Vision application, costs around $8. It allows users to have a single skin spot check, provide instant risk assessment based on skin type and risk profile. The 3-month plan, which goes for around $35, provides unlimited skin spot checks within a 3-month window, which includes risk assessment, personalized advice, body mapping, reminders for comprehensive monitoring, seasonal skin exam assistant, personalized insights and health advice, as well as health journey guidance and recommendations. The 12-month plan includes all of the amenities included in the 3-month plan, but for a year-long duration.
As for limitations of technology-based approaches, many mHealth applications addressing skin cancer are untested. This has important implications for diagnosis. The SMARTY trial was the first clinical trial of an AI diagnostic for skin cancer. When a clinician and an app disagree, this can cause stress for the patient, so this affects their decisions about tests and treatment. Skin.io seems to have used artificial intelligence to good effect to improve a clinician's ability to distinguish between benign moles and actual cancers, which may prevent some unnecessary removals of moles, but more work will help to determine how successful artificial intelligence can be. Neither of these mHealth applications have been examined for their accuracy with the full palette of human skin colors, so future work is necessary to ensure that AI does not replicate these mistakes. Another limitation that can be presented is that instantaneous feedback is limited due to the fact that image analysis is a human-executed, complicated task. Artificial intelligence is still a relatively new and developing concept that is still being improved upon, so it may be difficult to use. Few studies have attempted real-time decision-making in teledermatology, which is most likely a result of the challenges and complexity in immediate image analysis relative to the current store and forward methodologies or traditional treatment ways. Again, since it is still a running concept, there is much more to be done and tested.
Here begins our 3 slides of references cited in the presentation and another slide of image credits. Thank you. We look forward to your comments and questions.